Hi, I'm Heidi Bassfield, Executive Director of Speak Our Minds and Speak Our Minds podcast. Suicide remains the leading cause of death for our nation's youth. It's nothing short of a continued public health crisis. And on this series, we wanted to team up with providers and talk about what children's hospitals and our teams throughout this country are doing to take on this challenge and work every single day to have things be different, better for our youth. As part of this series, you'll hear from those providers, their teams, and what they're up to. They'll talk about new practices that they're putting into place, what they think has changed about the conversation with youth mental health, what their biggest obstacles are, what they would do about those obstacles, and what they're really excited to be a part of over the next 5 years. We also feature stories from parent caregivers who really bring home why this work is so incredibly important and how we can all join and be part of these efforts as a collective to turn the tide and prevent youth suicide. Thank you for joining us for Preventing Youth Suicide, a series focused on bringing about change. Okay, I'm here with Dr. Martine Lamy, who is a psychiatrist and pediatrician with Cincinnati Children, and you're going to tell us your official title.
Absolutely. Hi, everyone. I am Dr. Martine Lamy. I am a pediatrician and psychiatrist, and I serve as our Associate Chief of Staff for Mental Health at Cincinnati Children.
Which is one of arguably the largest provider of pediatric mental health services in a children's hospital in the country. I think I'm right.
We have one of the the largest inpatient system, as well as one of the largest outpatient systems in the country.
Yeah. Okay. So clearly I've got an expert here, and here's your question. All right. How has the conversation in youth mental health been changing, and what progress have you seen compared to just a few years ago?
I think one of the biggest things that is changing around the conversation is that we're actually having the conversation, right? Which, if we were talking a couple years ago, I think I would have had a very, very different answer, right? This is something that, I go over to family dinner at my mom's house and my cousins are talking about it. They're talking about what's happening at their kids' schools around mental health. And it's not a taboo subject, especially with kids and even our own mental health as adults. It's something that we're more comfortable to be open and honest about. And I think that really only helps make the care better because we can now talk honestly about what we need, what our kids that we serve need, and how we can make our current services better.
When you think about that now, and I agree with you wholeheartedly, there are just even to your point, more open conversations around the dinner table. How would you compare that to a few years ago? What was it like a few years ago?
Yeah. I think, a few years ago, we would go into settings in the community and there would just be you can just talk about anxiety, but let's not talk about anything more than that because that doesn't happen to our kids or that's not a thing that happens in our community. But, we know that, mental health does not discriminate at all. These things happen everywhere to everyone. And we can now have really in-depth conversations and really talk about hard things that made us really uncomfortable before. Now, maybe it makes us only a little uncomfortable to talk about it. I think the other piece around it is as professionals, we can now be more open and honest about our own struggles in our family and being able to use that again to design better healthcare systems to really actually meet the needs of what our families need.
What do you think? Was there a specific inflection point that things really started to change or a moment in time where you're like, whoa, this is really, we are starting to see some serious differences? Was it COVID?
I think it was COVID. I think that allowed us to have a different conversation of gosh, this isolation, this whole change to my whole world, it's really hard, right? And then just validating that maybe you had a different experience, but it was hard for you in a different way. And now we have this common thing, it was COVID, that we can talk about and how it affected us, how it affected our families, how it affected our day-to-day, and how it affected how we're feeling.
Yeah. Well, I couldn't agree more that COVID created this common experience that could open the door for this, which leads to the next question. We've seen all this progress. We are moving in a better direction, but there's still so much more to be done. Looking ahead, what do you most want to be part of creating over the next 5 years?
I think over the next 5 years, what I would most excited to create is really to actually co-create different ways of accessing mental health care with the kids and families and adults who are using these services.
Yeah.
I think sometimes in healthcare, we are really good at designing systems that might work for me personally, but are not necessarily going to be what our kids and families actually need, or what they want, or what they can access. And with this movement of really including the family voice and understanding what people in our community want, what they need, what they think would be helpful, we can co-create an incredible system together.
I think that's phenomenal. What's like a starting point for that in your mind? Where do we start with doing that?
I mean, I think a lot of hospitals have things like youth councils and family advisory committees. I think that's a really great way to start. I love the idea of youth councils, especially working with teenagers, right?
Yeah.
It's been a while since I've been a teenager, right?
Not me, clearly.
So, but our teenagers are very opinionated. They know what they need. And the other thing is they're really good at supporting each other. Yeah. So let's learn from them of what's working for them and then help them incorporate that into our healthcare system.
I love that. Okay, friends. Well, you heard it here. We'll be anxious to follow up with Martine, see how things are going in her effort to build these kinds of things and engage youth in the process and their families moving forward. Thanks for joining us.
Yeah, thanks for having me.